Are you thinking about getting a platelet-rich plasma injection in your knee? Here are the top 5 reasons you may not be a good candidate for PRP in the knees. PRP can be great. I've seen it help everything from ACL tears to patients who've been told they're bone on bone and there's nothing except surgery that's going to help, only to find that same patient still doing well at 5 years on and counting after a single PRP injection. But if you fall into any of these 5 categories, you have to be careful before getting your knee treated with PRP. These are things that not every clinician knows, so I'm going to break it down for you in this video. Stay till the end to find out whether your age is one of those 5 things. Reason number 1, recurrent swelling above the knee or behind the knee in a Baker's cyst. There are 2 places in the knee where fluid can become a big problem. One is at the top of the knee, above the kneecap, and the other is behind the knee in a place called a Baker's cyst. If you've had these areas drained and the fluid keeps coming back, this is going to be a problem, no matter what we inject into the knee. When we see this problem, PRP is probably a no-go. Damage causing the fluid collection is probably too severe for cell therapy. Reason number 2, loose bodies in the knee. This means that there are little chunks of cartilage, little nuggets that are broken off and are floating around inside your knee. These can cause locking and pain. There's no injection that's going to dissolve those nuggets. They need to be taken out with a scope. And if you can convince a surgeon to take these out, well, maybe you'll be able to take a look at PRP again down the road. Reason number 3, a bucket handle tear or root tear of the meniscus. So with a bucket handle tear, it means that the C-shaped cartilage inside your knee now is 2 C's. They've come apart and the tear goes from the back of the C to the front of the C. And it's very unlikely that this is going to heal even with a perfectly performed PRP or bone marrow aspirate concentrate procedure. If your meniscus is torn at the back of the knee, this is called a root tear and leads to instability and arthritis if it's left untreated. You don't want to do that. These things have to be fixed surgically. Reason number 4, a complete tear of your ACL. So if your ACL is snapped like a rubber band and the 2 ends are not even close to each other, there's no injection that's going to make them grow back together. You're going to need to have this reconstructed surgically. On the other hand, if the tear is not complete, then PRP and BMAC may be a great option. Reason number 5, all 3 compartments of your knee have grade 4 arthritis. Grade 4 is the worst stage, and if this is present in 1 out of the 3 compartments, or 2, then PRP might be worthwhile. But if it's severe arthritis present in all 3 compartments, you just got to be careful about your expectations if you do go through with PRP. In situations like these, it may be time to talk to a surgeon. Now hang on, I haven't talked about your age yet, have I? By the way, if you find this content helpful, please be sure to subscribe to our channel for more education about PRP. All right, if these 5 things don't apply to you, then you definitely need to consider PRP or bone marrow aspirate concentrate, also called BMAC, for your knee pain. Even if you have evidence for swelling inside the bone marrow in the bones of your knee, something called a bone bruise, there's still a chance that we can improve pain and function by using your own cells to heal the damage. PRP procedures can be very simple, but even in complicated cases, we can target those areas of bone swelling inside the bone with small injections of cells right into the areas of damaged bone marrow and cartilage. The idea of going in and just taking a look with a knee scope might sound tempting, but especially for patients over the age of 40, this may actually be doing more harm than good. Some studies now showed that the simple act of putting a scope into the knee can accelerate the progression of arthritis. No bueno. This is one of the reasons you should always consider non-surgical options like PRP and BMAC first. Since you don't have to go through surgery, the recovery time after PRP and BMAC is much quicker than after even a simple knee arthroscopy. This allows you to return to work and physical activities that you enjoy, like biking, swimming, tennis, and golf, much sooner than you would if you had surgery. Additionally, most of the time when you're getting arthroscopy, you're not really doing anything to help the health of your cartilage, your ligaments, and your bones. You're just going in there, taking out or fixing the damaged tissue, and then hoping for the best. Wouldn't it be better to go in without a scope using a small needle to inject pro-growth cells from your own body to trigger healing and promote the health of cartilage, bone, tendons, and ligaments? When we treat your knee with your cells, we also inject multiple places all around the knee, not just inside the knee joint. These places include tendons, ligaments, muscles, and bursa on the outside of your knee, places that are simply not addressed with arthroscopy. If you've checked out this list and none of these 5 things apply to you, you should definitely be thinking about PRP or BMAC for your knee condition. Finally, a person's age has nothing to do with whether or not they're a candidate for PRP and BMAC. It all comes down to whether or not the patient whether or not you are a good candidate. Are you ready to live without knee pain like the hundreds of other patients we've helped? Click on the link in the description below to book a consultation.